Hello friends, so today we'll be discussing about quinolones. More commonly you would heard about fluoroquinolones. Okay, so this group of antibiotics, you have quinolones, only nalidixic acid is there, and then later on, because it developed resistance and then it could cover only gram-negative organisms, what we did was we did some structural modifications to this nalidixic acid. So the resultant components are called as fluoroquinolones that help to extend its spectrum, make it less resistant to bacterial organisms, and more clinical uses. So you can see here what they did was they fluorinated the 6th position and a piperazine group was added to the 7th position. So we have then the fluoroquinolones, which are again divided into different generations. Okay. So they are basically active against gram-negative organism. So you know that in case of beta-lactams, which group of organisms are they primarily active against? Gram-positive. And then you have extended spectrum penicillins, which are active against both gram-positive and gram-negative. Similarly, quinolones and fluoroquinolones are primarily active against gram-negative organisms. Nalidixic acid was the first quinolone. Because of its resistance, we have newer quinolones, that is, the fluorinated quinolones, which are otherwise known as fluoroquinolones. So now we come to the classification of fluoroquinolones. We have first generation, second generation, third generation. So first generation is active more against gram-negative. You have NCOP is a mnemonic. You need to remember just 2 or 3 examples in each generation. So you have norfloxacin, ciprofloxacin, ofloxacin, pafloxacin. So these are active more against gram-negative organisms. Okay. So all of this ends with floxacin. Okay. Now second generation, the mnemonic is smell. Again, remember 2 drugs: sparfloxacin, moxifloxacin, levofloxacin, lomifloxacin. Gemifloxacin, actually we can say it is a latest addition. We can even say it as a third generation fluoroquinolones. Okay. Now what is the mechanism of action of fluoroquinolones? We have seen beta-lactam, how does they act? They act by inhibiting the cell wall synthesis, by inhibiting the peptidoglycan cross-linking. Or in case of tetracyclines, chloramphenicol, aminoglycosides, macrolides, how do they act? They act by interfering different stages of protein synthesis in bacteria. Similarly, this interferes with the DNA separation. Okay, what it does is it inhibits an enzyme known as DNA gyrase. So what does this DNA gyrase do? DNA gyrase in case of gram-negative organism and topoisomerase 4 in case of gram-positive organism. So DNA gyrase is an enzyme that helps when the DNA starts to uncoil itself. There will be presence of positive supercoils, just like when you're trying to separate out 2 strands that are wound together, you can see there will be positive recoils. To prevent the formation of positive recoils, what this DNA gyrase does is, it cuts one strand and then it introduces negative supercoils and then it reseals the strand. So this cutting and resealing is done by one subunit, that is A subunit. The introduction of negative supercoils is by B subunit. So fluoroquinolones, it binds with this A subunit. You can see here the A subunit will cut, then B will introduce negative supercoils, and then it will again get resealed. So fluoroquinolones, they bind with the A subunit and interferes with the cutting and resealing function. In case of gram-positive, it is a topoisomerase 4. In gram-negative organism, it is a DNA gyrase. Hope it is clear. So once if it is interfered with, what happens? The DNA replication is inhibited. There is damaged DNA which is digested by the exonucleases, and that results in bactericidal action. Okay. In gram-positive, the major target is topoisomerase 4, which separates this interlinked daughter DNA. Now, how can it produce resistance? Mainly by decreasing the affinity of fluoroquinolones to this topoisomerase. So chromosomal mutation that produces a DNA gyrase or topoisomerase 4 with reduced affinity to to fluoroquinolones. Other than that, it can reduce a permeability inside to the cell or increase efflux of those drugs are other mechanism. But major mechanism is for fluoroquinolones to act, it should come and bind to this DNA gyrase or topoisomerase 4. So it will produce mutation so that it does not have a liking for DNA gyrase or topoisomerase 4. There are certain properties for fluoroquinolones. You need to know what is meant by concentration dependent killing or time dependent killing. We've learned about this time dependent killing when we learned about beta lactams. Beta lactams follow time dependent killing, whereas fluoroquinolones, aminoglycoside, and all follow concentration dependent killing or CDK. In simple words, the killing effect is dependent upon the initial concentration, the peak concentration to MIC is a minimum inhibitory concentration. That is the minimum amount that is required to kill a particular concentrate of organism. So that ratio is what determines their killing capacity. Whereas if a drug follows, if antibiotic follows time dependent killing, it is the time above or the duration for which the antibiotic levels is remaining above the MIC level is what determines their killing ability. So for them, we need to distribute the drug and give in short intervals so that for a long period, the drug concentration is remaining above MIC. But if it follows concentration dependent killing, like in case of fluoroquinolones or aminoglycoside, it's an initial ratio, that is the amount peak concentration to the MIC ratio is what determines. So the clinical application is for those drugs which follow concentration dependent killing, you can give it as a single dose. Okay. So in case of aminoglycosides, when you give it as a single dose rather than in divided doses, the incidence of toxicities like nephrotoxicity, ototoxicity and all is less. Another property of this is it has got long post-antibiotic effect. Even after the antibiotic is removed from the body, it is having an inhibitory effect on the organism, both for gram-positive as well as for gram-negative organism. Okay, even after the drug is removed, it is having a post-antibiotic effect. Pharmacokinetics, you can give it orally. It has got good oral bioavailability. Maximum is for levofloxacin, least is for norfloxacin. But norfloxacin, we give it mainly for UTI. It attains good urinary concentration. Multivalent cations can interfere with its absorption. So, you should be careful when you're giving it with antacids like aluminium hydroxide and all. Aluminium can interfere with its absorption. Longest half-life is for sparfloxacin, 20 hours, followed by moxifloxacin, 12 hours. Excretion is by kidney. What is the significance of knowing it is by kidney? You need to reduce the dose in case of renal failure. The exception is PMT, pefloxacin, moxifloxacin and provafloxacin. So you need not reduce dose of these drugs in renal failure. And what are the uses? Mainly we use it against gram-negative organism, but the newer generations have got extended activity against gram-positive and as well as anaerobic infections. So since it is having more of a gram-negative coverage, not much of a use in dentistry. Okay, but the one exception is if you're suspecting pseudomonal infection, then this is one of the oral agents that we can use that has got activity against pseudomonas. So we use it for UTI, again gram-negative organism like cystitis or prostatitis. Bacterial gastroenteritis that is caused by Shigella, Salmonella, Vibrio. Then there's as I said earlier, oral agents with the greatest activity against pseudomonas, especially ciprofloxacin and levofloxacin. There are certain respiratory fluoroquinolones like levofloxacin, gatifloxacin, gemfloxacin, moxifloxacin, which has got activity against gram-positive atypical infections as well as for multi-drug resistant tuberculosis. Okay. So since I told the extended spectrum has got activity against gram-positive, we can use in dental infections. So these are the agents that are specifically useful for this condition. gatifloxacin, ofloxacin, and moxifloxacin. Then for periodontitis, you can use a combination of ciprofloxacin as well as metronidazole if you're suspecting mixed infection. Ciprofloxacin will cover majority of the gram-negative and few gram-positive. Metronidazole will cover for the anaerobic organisms. Okay. Again, this is important. You give ciprofloxacin plus metronidazole for periodontitis. Other uses is you can use it for typhoid infections, for prophylaxis of anthrax, meningococcal meningitis, neutropenic patients. Phenafloxacin can be used topically for otitis externa that is caused due to staph or pseudomonas. Treponema pallidum and nocardia are resistant to all fluoroquinolones. So basically remember the gram-negative infections. It can be UTI or bacterial gastroenteritis. Then it is active against typhoid. There are certain respiratory fluoroquinolones that can be used for respiratory infections like gram-positive infections or atypical pneumonia or multi-drug resistant TB. Plus, in dentistry, gatifloxacin, ofloxacin, moxifloxacin specifically has got utility because they cover gram-positive also. And you combine ciprofloxacin plus metronidazole in case of if you are suspecting mixed infections. Now, what are the adverse effects? GI adverse effects can be there like nausea, vomiting, anorexia, dysgeusia means alteration in the taste. Then CNS, there can be dizziness, restlessness, tremors. It can increase a seizure threshold, so it is contraindicated in epilepsy patients. Most specific adverse effects for fluoroquinolones is tendinitis and cartilage problem. It can cause inflammation of the tendon as well as it can cause cartilage problems, because of which we do not give it in pregnancy and children below 18 years who are in the growing phase. We don't want to interfere with the tendon as well as for the cartilage. Certain agents can produce QT prolongation in the ECG. Okay, that is parfloxacin, gatifloxacin. So you should be very careful when you're giving it with enzyme inhibitors. That is those drugs which inhibit the metabolism of inhibit the CYP450 enzymes like erythromycin or ketoconazole, that can increase the concentration of these drugs and that can result in arrhythmias. Then sparfloxacin also known to cause phototoxic reactions, and there is a warning regarding peripheral neuropathy that is caused by fluoroquinolones. And there are many fluoroquinolones that are banned because of adverse effects. Gatifloxacin because of dysglycemic effects. It can precipitate diabetes. Trovafloxacin because of hepatotoxicity. Temafloxacin because it induced immune hemolytic anemia. Clinafloxacin because again of phototoxicity. Grepafloxacin because of cardiac toxicity. Interactions, it can inhibit the metabolism of theophylline, caffeine. NSAIDs can enhance the CNS toxicity, precipitate seizures, so should avoid NSAID combination. Antacids, sucralfate reduces the absorption of fluoroquinolones. So that is regarding fluoroquinolones. So you need to know the examples, that is the first generation, second generation, and gemfloxacin. You can say it as a third generation. Mechanism by inhibiting DNA gyrase in case of gram negative or topoisomerase in case of gram positive. They bind with the A subunit, inhibits a nicking and resealing, and thereby DNA replication is inhibited. Mechanism of resistance is by chromosomal mutation and decreased affinity. Then you have uses mainly gram negative like UTI, bacterial gastroenteritis, meningitis, typhoid, respiratory infections. Then the second generation have got more activity against gram-positive and anaerobes, because of which we can use in dentistry. Oral cavity infections, especially mixed infections, you can combine ciprofloxacin with metronidazole. Adverse effects, GI side effects are important. Then you have specific agents that are causing phototoxicity, QT prolongation, peripheral neuropathy. Most importantly, remember it can cause tendinitis and cartilage problems, because of which it is contraindicated in children as well as in pregnancy. Okay. So these are the important things about fluoroquinolones. Hope you understood. Thank you for listening.